When it comes to many reaching their optimal quality of life, it can be said that chronic pain is one of the leading barriers in the 21st century. It's been estimated that as much as 1 in 5 people experience it in one form or the other. Chronic pain isn't just severe discomfort caused day to day, but also impacts things like people's self esteem, daily activities, social life, sleep, energy, ability to work, concentration, appetite, mood, mental and physical health, and relationships with those around them, to name a few. While certain pain is indeed helpful for us, like acute pain that acts as a sort of alarm for us to stop, slow down, and adjust accordingly, so we can prevent even more pain occurring, chronic pain serves no useful purpose. A systematic review states that acute pain can range from 1 day to 12 weeks, while chronic is any amount that extends beyond this. Upon hearing chronic pain, your brain probably immediately jumps to conditions such as non-specific low back pain and maybe to a lesser extent fibromyalgia. But one other chronic pain disorder that doesn't get a fraction of the spotlight that these do, but can be just as debilitating, is complex regional pain syndrome. Therefore, today we'll explain what it is and give you an idea of how to help it. But first, as always, please take note of our disclaimer. Over the years, complex regional pain syndrome, or CRPS, has gone by many names. There are two types of it. The most common, CRPS1, estimated to make up 90% of cases, is when there's no confirmed presence of nerve injury, while the other, CRPS2, has established associated nerve damage. Currently, for either, there are no specific tests that confirm it available, so practitioners often rely on clinical findings. It's marked by being extremely sensitive to touch and having limb pain in certain situations much more severe than one would expect. Other common findings are swelling and stiffness, alongside temperature and colour changes. The exact cause of CRPS is unknown, but it's thought to stem from a dysfunction in the central and peripheral nervous system. Genetic and psychological factors are also hypothesized to play a role in its development. How the condition progresses is seen in two stages. Firstly, there's the warm phase. This happens initially when the sympathetic nervous system is decreased, leading to lower levels of norepinephrine in the blood. Accordingly, blood vessels start to open and more blood can travel to the affected limb, causing skin redness and warmth. And following this, there's the cold phase, where the opposite occurs. Basically, the sympathetic nervous system then starts to contrarily increase to levels higher than it should from an excessive buildup of pro-inflammatory cytokines happening over time, causing the blood vessels to narrow and reduce blood flow, culminating in cold and blueness in the region. Regarding CRPS risk factors, women are much more susceptible to the condition, as much as 4 times that of men in fact. Those with fibromyalgia and rheumatoid arthritis also have higher odds, as well as people who have had a prior injury. An analysis carried out on approximately 1,000 individuals found that when it came to injuries, fractures were the most frequent reason the condition developed, followed by traumatic injuries that didn't result in a fracture, like a sprain for example, surgery, carpal tunnel, and no apparent reason discovered. Interestingly enough, CRPS has been found to be a relatively unique disorder in that, unlike many other disorders where obesity, diabetes, and hypothyroidism increase risk, these have actually been shown to reduce CRPS likelihood. Fortunately, the overall likelihood of getting CRPS is pretty low. For instance, the largest population-based study in the US found that out of over 33 million inpatients, only about 23,000 people, give or take, were given its diagnosis. So that's less than even 0.1%. And say you are part of this marginal population. Several evidence-based interventions are still available to help with it, so there is reason to be optimistic. Physiotherapy, occupational therapy, psychiatry, pain medicine, as well as pharmacological and surgical strategies are all approaches at one's utility. Yet, since we have a physiotherapy background, we'll focus on this area in particular. But just on a quick side note, If you'd like to undertake our evidence-based and results-backed personalized Plato weight management program, please click the link in the top right-hand corner of the video or follow the link in the description. Several interventions have been studied regarding CRPS, including massage, electrotherapy, acupuncture, gentle range of motion, and isometric strengthening. However, a Cochrane review of 18 randomly controlled trials has shown that mirror therapy has the most significant impact on pain and quality of life. In a nutshell, the treatment is used to trick the brain into thinking that the affected limb performed the movement without pain. It's done by putting the affected limb behind the mirror so the reflection of the unaffected limb appears in its place. Both limbs move while doing mirror therapy, but the affected limb you can't see only moves to the point of pain, while the unaffected limb you're looking at in the mirror completes the full range of motion. Mirrortherapy.com suggests that due to CRPS pain, the sensory motor part of the brain of the relevant limb becomes less active, and so does its subsequent movement. While this may seem good at first thought, since it helps to avoid pain in the immediate sense, the lack of activity causes pain to increase over time, which disorganizes the brain further. Yet by carrying out mirror therapy to help your brain think it's performing the movement of the relevant limb without pain regularly, the mapping of the brain can be rewired back to a more default state and thus facilitate pain relief. Just make sure to start with simple movements and progress to more complex ones over time. Remove jewelry and watches or cover tattoos which might make it more challenging to trick the brain. And do it for at least 5 minutes 4 times daily. Have you been diagnosed with CRPS before? What were your experiences? We'd love to hear from you in the comments section down below. Additionally, if you're new here, make sure to like and subscribe to our channel. So that has been our video. Thanks for watching, and I'll see you next time.